Hello, everyone. Good evening, good evening, good evening. Technical glitch right there. Thank you so much for tuning in for Ask Me Almost Anything. August 26th, it is 7:05 p.m. Eastern Daylight Time. So, welcome to Ask Me Almost Anything. This is a live session where I come to you in your living room, in my living room, just to chit chat for a little bit about questions that you may have about brain health, longevity, food as medicine, healthy aging, caregiving, anything that is top of mind that you may have questions about and have been afraid to ask. Maybe you've run out of time with your doctor and your nurse practitioner, your medical visits. Maybe you're a reader of my newsletter, Siva Living, Siva Science and Soul, uh, part of that community. Maybe you've listened to the podcast. Maybe you've seen me on a podcast before, whether here on YouTube with another health professional or wellness professional, or maybe you've seen me speak somewhere. Wherever you have found me, I thank you very much for joining me this evening. And this is just really casual. So I want you to just sit back, relax, tune in to some of the questions that I've received in my inbox. This is something I was doing for a long time. And I stopped doing it just because of time crunches and whatnot. And then I've got back to doing them. So if this is your first time joining me for a live session, it is Ask Me Almost Anything. And the almost is there because I can't give you medical advice about your own personal health conditions or health concerns, but we can talk about things in general. We can make some of the science more simple. We can demystify healthcare and we can demythify healthcare, right? So we can talk about some of the things that are just myths, things that people have been saying for years and we assume it to be true. We can take some of the mystery out of things and give you some things to think about in the private setting you may have with your own healthcare provider. So, the process for this is really kind of simple. All you do is just use the link in my show description to send me your question. Send me any question you may have that is not about your personal health condition. So I can't give any health advice, but any question you may have. Use the contact link in my show description to send me your question. Every Friday, I am going to go through the questions that come in. And those that I know for sure have come up in my own clinical practice or in my travels, I will present them here on an Ask Me Almost Anything segment and attempt to answer them as best as I can, and maybe even provide some resources. And though I didn't say this from the beginning, I'm Angel Shannon, founder and executive director of Siva Health and the Siva Institute. I am a board certified nurse practitioner, lifestyle medicine clinician, and speaker, writer, mom. I do a lot of things that directly relate to adult and geriatric behavioral health as well as internal medicine. So let's jump in right now. I also want to say if you are not a subscriber yet to my newsletter, please use the link in the show description. JoinSivaLiving.com. It's JoinSivaLiving.com. My free newsletter where every 2 weeks or every 2 weeks ish, I do a deep dive into topics that relate to brain health, longevity, food as medicine, healthy aging, caregiving, as well as just the art of living well. The art of living well. So, under that umbrella comes things like meditation, forest bathing, mindfulness practices, journaling, things like that. Okay. So, I want to jump right in because I have three questions I'm going to try to answer within this time frame. But I want to make sure that I answer them, clearly. And holistically, if I can get to the third, I will do that. But I definitely want to take these first two questions because this is something that comes up in my clinical practice a lot. As I said, I am a nurse practitioner, so I always get these kinds of questions from adults about their elderly parents. And this is a question that came up recently and came into my inbox at the same time. Let's see here. Moderation. We're going to close that. If you have a question, please drop it in the chat. If you are watching this broadcast or this live session after the live session, if you're watching this afterward, um, please just leave a comment because I will have some time preserved to look over the comments. And if I can answer those questions in the comments, I will definitely do that as well. Okay. So the first question that came in my inbox is, hi, Angel. My sister and I have a debate. If a person has been showing signs of dementia, does it matter what kind of dementia it is? Is it ever too late to find out? Example, 3 years down the line. So let me read this again. My sister and I have a debate. If a person's been showing signs of dementia, does it matter what kind of dementia it is? Is it ever too late? Is it too late to find out? So, this is a very good question, especially for me as an adult geriatric nurse practitioner, because I have a large panel of seniors and elderly patients, and I provide consultation for their adult children caregivers. Now, first, I want to say, first and foremost, dementia is an umbrella term. It's an umbrella term that describes, and I'm going to read this because I want you to hear this clearly. It describes a decline in mental ability, including memory, thinking, and reasoning, that is severe enough to interfere with daily life. Okay. That is the umbrella description and qualification. And I want to underscore this part about interfering with daily life. So we're talking about activities of daily living, which would include grooming, bathing, cooking, driving oneself to the doctor, scheduling one's clinical appointments, managing one's finances, managing things around the house that require services. So let's just say the lawn service or someone coming to the house to do cleaning or things like this. It's the impairment that impacts daily living. So that's an umbrella term, dementia. Now, we know that there are different types of dementia. There's Alzheimer's dementia, there's Parkinson's dementia, there's Lewy body dementia. There's a dementia that can just occur as a result of traumatic brain injury, right? So, because there are different types of dementia, it is always very helpful to distinguish which type a person may have because it governs to a large degree how that condition can and should be managed, especially as it pertains to medications that will slow what we hope will be slowing the progression of the disease and any symptoms that result or problems that result that occur as a result of the disease. So let me give you a perfect example. In some cases of Alzheimer's dementia, there may be changes in mood, there may be changes in personality, there may be changes in orientation, there may be changes in one's ability to sleep, the sleep cycle. And so at some point, there may need to be medication that helps a person fall asleep. There may be a need for medication that helps with the mood. There may be a need for medication that could help control impulsive behaviors and maybe even some violent or aggressive behaviors. Okay. So knowing that the individual has Alzheimer's disease would help to dictate which medications would be safe, especially as it pertains to what we hope would be slowing the progression of the disease. Another example that I can give you would be Lewy body dementia. Oftentimes, we will see in Lewy body dementia, unfortunately and quite sadly, uh, uh, um, symptoms of hallucinations, visual hallucinations, auditory hallucinations, seeing things that aren't there, things like this. So there are medications that are specifically labeled for control of those kinds of symptoms. The same thing with Lewy body dementia, same thing with Parkinson's dementia. It is very helpful when a clinician knows what kind of dementia an individual has, because it governs the treatment, especially in the realm of medication. It also helps the caregivers to be able to understand this as well, because as the disease progresses, and we do know that dementia is a progressive disease, as the disease progresses, it's helpful when that for a family to know what's coming, to know that there is a probability, or that there's a possibility, I should say, that someone could develop hallucinations, visual, auditory hallucinations, could have some behavioral disturbances. If there's a frontotemporal dementia, and there are changes in personality, changes in mood, changes that make the person more aggressive and more impulsive, it would be helpful for the family to be able to get that education sooner in the disease process rather than later, because it is very, very debilitating. And it is very hard as a caregiver to witness a person that you love declining, especially declining over time, slowly declining, losing their memory, losing the ability to hold a conversation, losing the ability to care for themselves or participate in activities or hobbies of interest, things that they once enjoyed. So it's very helpful from a caregiving standpoint, so that a family can understand what could possibly be coming down the road, can plan for that financially, can plan for that in their own household in terms of caregiving needs and things like this. So I always say to individuals who have someone that they love and care about, who is showing signs of dementia, to always, 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 involve two very important people on the healthcare team. One, a neurologist who can diagnose brain disorders and memory disorders and do a very robust workup and assessment of what's happening in this person's brain, in their life, their behaviors, changes in their patterns of speech, changes in hearing, changes in orientation, behavioral shifts, things like this. So one, the neurologist. Second of all, always your primary care provider, the primary care provider should always be aware and alerted to changes in behavior, in mood, in memory, in sleep, all those kinds of things, because what the primary care provider can do is make sure that there isn't something medical happening. So, for a prime example, a very common finding in elderly women is urinary tract infections. And men can get them too, but a very common finding is urinary tract infections. And you absolutely can see changes in an individual's behavior when there is a urinary tract infection. And you'd hate to have someone diagnosed with something that they don't have, all because of a urinary tract infection or pneumonia or the flu or COVID or any other medical illness, something that is not psychiatric or even neurological. A third person that I like to involve in my own ecosystem is the neuropsychiatrist. Neuropsychiatry and neurology are two different specialties. So I often refer to neuropsychiatry as well, just to get a full, robust, and well rounded assessment. So I hope that answers that question. And to the individual who sent it in, if you have additional questions, certainly feel free to either send me a note in the on my contact form that is listed in the show notes and show description, and I'll be happy to answer that for you. So the next question is about another thing at the opposite end of the spectrum, and this is choosing the right mental health professional. And this question came in about how to choose the right therapist. Hi, Angel. With everyone in therapy these days, how do you choose the right therapist? When therapists are getting far and few between, many are not accepting new patients, and oftentimes it's just a matter of scrolling online. How do you find the right fit? That's a wonderful question because people ask me that all the time. How do I find the right fit? Beyond just scrolling online or going off of, what someone else said or a flashy website that says all the right things, checks all the right boxes. So I have some tips that I wrote down that I really want to share with you. And first and foremost, I want to say that mental health is not unlike any other health condition. Everyone experiences their own mental health or mental health crises differently. Depression is different for everyone, anxiety is different for everyone. Sadness, grief, loss, adjustment, everyone experiences life differently. And so, because of that, there is no real cookie cutter approach to managing an individual's mental health. And it is absolutely about finding the right fit. Um, First and foremost, what I want to say is, you know, accepting the fact that there are lots and lots of different therapists in the healthcare, marketplace, and knowing that it does take time to find the right person for you, not unlike the right heart doctor or the right gynecologist or the right anyone else. Okay. So here are some questions that I generally will give my clients and patients to ask when they have their intro sessions. So first and foremost, do you have a particular treatment approach? So once you're going through websites, you find the person and you're going to schedule your intro call or what have you, or your first appointment, during that first appointment, do you have a particular treatment approach? Every therapist is trained in different modalities and has different treatment approaches. It's important to know what kind of treatment approach the individual has that you'll be meeting with. What can I expect during treatment? So it's important to understand what the expectations are, or what to expect during the appointment. How the appointment is structured. Is it online? Is it in person? Is are there activities that will be done? Is it all talking? That's an important question to ask. What is your background? It's important if the individual doesn't have these things clearly identified on their public profile website or LinkedIn page or wherever you found them, it's important to know what their background is. And background is more than just where they were educated, what school they went to, where their certifications are, but background in terms of what their life background is, because that too can inform your decision about how to choose a therapist. And when I say background, I don't mean every detail of the person's life, but it is helpful to know where the person grew up, what country they may be from, their country of origin, what other languages they may speak, what their interests are. Some general knowledge about the person and their background can always be helpful and inform you, better inform you about who this person is and whether you might be a good fit for each other. Do you have a specialty? That's also important. It's great for me when I am able to find therapists who have specialty in gerontology, for instance. Older adults experience depression and anxiety also. Every older adult doesn't have dementia or cognitive impairment. So it is helpful when I find or come upon a therapist who has background in gerontology. So, or knowing that the person has a background, I'm sorry, specialty in grief disorders or anxiety or panic disorder, things like this. So that's helpful. What is your approach to conversations about medication? Now, this is a really important question for me that I generally, and I just want to check my time. Oh, here I am. Okay. This is a really important question because while therapists do not prescribe medications, um, what they do is often get involved in conversations about medication. So oftentimes they may be in session with a patient or a client, I should say, and understand and start, understanding or witnessing that the person, let's just say, for example, may have severe anxiety during the sessions. And sometimes a therapist or uh, a therapist will bring up the conversation about medication. Do you think that medication might be helpful? Do you think that you've reached the point with in this depression or anxiety that medication may help you with these symptoms where you're not motivated or having no energy or feeling apathetic or things like this. So knowing that a therapist has an aversion to medication or is supportive of the use of medication is very helpful to know in your journey. Let's ask another question. Oh, I said, is there someone I can talk to in an emergency? That's an important thing to know, especially if we're talking about older adults. Older adults, using telehealth services or having a therapist. Is there someone that they could talk to in an emergency other than the therapist themselves? And I guess this applies to everyone, but I'm really thinking about my older adult population who sometimes has difficulty with scheduling and, being within that 9 to 5 window and whatnot when they have specific needs. How long are the sessions? That's important. Oh, here's an important one I wrote down. Do you charge if I miss my appointment? So this has been a big thing online about missing appointments and no shows and things like this. It's a very, very touchy subject for many people. And I know many people do not understand and may think it's unfair to be charged if they miss an appointment. But if you think about it, if 5 people miss their appointments and then one day and then another 5 the next day, that clinician would be completely out of business if that pattern continued. So it is very important to understand what the business practices are of the therapist that you're considering working with. How much do you charge? Of course, insurance, things like this. Do you accept insurance? Um, do you file the claims with the insurance or do I have to file my own claims? These are some of the things that I wrote down. Also, your role. What is their expectation of you as their client? Because every relationship is two-way. So understanding what your responsibilities are as a client and what your role is as the client is also really super important. Okay, so those are some of the questions that I typically will have, sort of put down on a treatment guide for my patients and my clients, and it has been very helpful in establishing clear, transparent communication from the beginning, as well as understanding, roles, responsibilities, expectations. And I always say that the way a relationship begins is the way it ends. You always want to begin on a positive note. Transparency is everything in every relationship, whether we're talking about husband and wife, boyfriend and girlfriend, partners, friendships, your relationship in your job and your career. Transparent, clear, open, honest communication is I just think fertile ground for a very positive and meaningful relationship. And to me, it's just everything. So it's one of my most important core personal values. And I have witnessed how, beautiful therapy can be when the expectations are clear and the communication is clear from the very beginning. So, that's another thing that I wanted to add in there as well. Oh, there was one other question that I wanted to answer, and this was about the role of different roles, people on on the healthcare team. And I didn't write it down. I thought I had it in my notes, but I didn't. But the question had to do with what is the difference between it had something to do with the service difference between a nutritionist and a dietitian, and when you see one versus the other. What I will say about that is that they are two very distinct roles, the nutritionist and the dietitian. Dietitians are licensed professionals. They undergo significant training in dietary and food sciences. Nutritionists have a totally different training and background. Both work hand in hand and are absolutely exceptional at what they do in terms of working with individuals who really need to focus on food as medicine, meal planning, understanding food science, understanding, carb restriction, protein restrictions, understanding and cholesterol management and things like this. So what I always say to individuals is, if understand that there are so many different specialties in the healthcare team, on the healthcare team. And the very best thing that you can do is be aware of all the different specialties that are available to you, whether it be psychology, psychiatry, nutrition, registered dietitian, physical therapist, audiologist, nurse practitioner, medical doctor, massage therapist, you name it. There's dentist, periodontist, orthodontist. There's so many of us in healthcare, all of us working toward the one goal, which is to help you be well, live longer, live better, receive exceptional healthcare. So, what I always say is a simple search online using valid resources like, let's just say, Harvard review, Harvard .edu, I think is a website, Mayo Clinic, Cleveland Clinic, going to reliable sources and literally just typing in what is the role of a nutritionist, what is the role of a dietitian, and oftentimes on in quality resources like that, you will see links to the national associations. So you'll see a link to the American Medical Association or the American Clinical Society of Endocrinologists, which is the diabetes professionals. You'll see the American Association of Nurse Practitioners, which is a certifying body for nurse practitioners. So what I'm saying is, once you get to those websites that govern the practice of that particular professional, you'll get a really good, strong sense of what that professional's role is, what they do, how they can help in the overall picture of your health, and then start taking action to bring them on your healthcare team. I always say one person cannot do anything, everything. And one person should not be responsible for everything. Gone are the days that we would just go to the doctor and rely on the doctor to do everything. Health is such, healthcare is much more complex. Our conditions are much more complex these days. And so one person cannot do everything, nor should they try to do everything. And it's beneficial to all of us to have individuals on our healthcare team that can collaborate, share knowledge, share experiences, share research studies. Certainly those who are in endocrinology, diabetes, they see those studies every day. They know those medications, the GLP-1s and all those things, they know them inside and out. The cardiologists, they know what the updates are in their branch with all of the blood pressure medications and the different clinical guidelines, what kinds of studies there are now for, assessing risk factors for heart disease and genetic markers and things like that. So I always say it's valuable to see a specialist at least once, in most cases, to understand what their role is, what they do, and how it informs the greater picture of one's health, and interest in longevity and disease prevention. So I'm sorry I thought I had that in my little pile there, but I didn't. But that was the gist of the conversation, the gist of the question that had come in. So we are at the 30-minute marker. I am so happy that we made it in 30 minutes. I was thinking, I was wondering if 30 minutes would be enough, but I definitely think it is. So we answered those three questions. And so I am going to be back on again in September, 2 Wednesdays a month for now. If the questions pick up, maybe I'll be on every Wednesday. I don't know. But for now, 2 Wednesdays a month, I've got them isolated. Be sure to subscribe to the channel because what we're going to do is schedule them out here so that you'll be able to see and look in the community posts because I'll make sure that they get posted there with the dates and times. It's always going to be 7 p.m. and it's always going to be Wednesday, but that you'll have the dates in there so that you can plan accordingly. If you're not subscribed to the channel, please do subscribe tonight. It's just click that little red button and hit subscribe so that you get the notifications, not only about the Ask Me Almost Anything sessions, but also about upcoming podcasts, interviews, and the general goings on at SIBA Health and the SIBA Institute. I want to say one other thing that was front of mind. Oh, join SIBALiving.com. Join SIBALiving.com. That is the newsletter. Be sure to sign up for the newsletter because we have been doing a lot since March with this newsletter. There's now a Brain First edition. So this is the upgrade to the newsletter, the free newsletter that I put out, but the Brain First upgrade is, oh my goodness, it is really good. It is literally a deep dive. So it's Brain First Deep Dive. It's by subscription only. You get an amazing PDF that takes a deep dive into exactly what I was talking about in each newsletter. So let's just say if we're talking about sleep, the first deep dive was on sleep. So if you're subscribed, you're going to get the Brain First Deep Dive clinical guide on chrononutrition, sleep medicine, the labs that I order, the protocol that I often give my patients. This is a deep dive, not a treatment plan for you. It's not medical advice. It's so you take a deep dive into how we make decisions as clinicians and that you develop the language to be able to go to your doctor, your pulmonologist, your sleep study, whomever, and say, hey, I was reading such and such. Would it be helpful if I had a sleep study? Would it be helpful if maybe I could, do some more lab tests or things like this? Any clinician who is worth their salt will be happy to have an educated patient in front of them because educated patients do better. Educated patients know better, and when you know better, you tend to do better most times. So this is the deep dive. It's usually about 5 to 6 pages, but it's everything that I know I would want to know as a healthcare consumer, because prevention medicine is where it's at now. People are living longer because we have so much more knowledge about prevention. We have so much more knowledge about early screening, genetic markers, biomarkers. We know so much more about the role of sleep, the role of stress, the role of nutrition, that we can turn up certain genes, turn down certain genes with certain foods. Oh God, I could talk about it all night, as you can see. So be sure to subscribe to Brain First Deep Dive. It is the subscription edition of my newsletter. I'll put the link down in the show description, the show notes. And if you have any questions about that, be sure to leave me a comment. All right. Thanks for tuning in. Thanks for joining me after, and tune in for the next Ask Me Almost Anything sessions coming in September. And be sure to send me your questions. And hopefully, I'll be able to answer one or more of them on an upcoming episode. Take good care, be well, be good to yourself, and never, ever, ever, ever be afraid to be amazing. Take good care. Bye bye.